Okay, my son Willie used drugs, alcohol, and various substances for over 22 years until they finally took his life. He lived and grew up in this community playing hockey and other sports. He loved spending time with his friends, but somewhere at a young age he decided to try drugs. It did begin with pot, which we assumed he'd grow out of, and progressed to alcohol, oxy, delving into coke, speed, meth, and fentanyl, among others. I don't know, and when his loving cousins told me, I did not believe it. Yet he might try this. It was not going to be addictive. I think I missed a sentence. His young, loving cousins told me that he was using coke and stuff like that. I just, in my head, did not think it would be addictive, that using it once or twice, that it would not kill him. All he had to do was say no, and he could just stop using. How hard can this be? I did not know the severity of his struggle, and when I did, there were no resources. Addiction and mental health were not the narrative when Willie was younger. It was not spoken about back then. Unfortunately, throughout this journey, we are all underinformed, naive, and we're influenced by social stigmas which are still prevalent in today's society, which we're now trying to battle. One piece of advice I'd always subscribed to was that he would only quit once he had found his new low. Although I personally do not believe this anymore. Instead, I've learned that the lowest point in using is death. They don't come back from this. After many years, Willie battled with his mental health and addiction using harder drugs, getting into more trouble, and experienced bouts of success with rehab and treatments, and lows where he continued to use again. But then came along fentanyl, which was one of his drugs of choice, and which subsequently led to his overdose. This is what's killing our community, our loved ones, friends, family, partners, and children. In hindsight, I would have attended more to Willie's mental health than his substance use, since substance use was a symptom of his struggles. I believe that mental health needs to be addressed first in order to help treat the addiction. What Willie and others have experienced within many of our system is that they had to deal with their drug use before being helped with their mental health, which is backwards. If they cannot work on the mental health struggles, how can they get off these substances? We believe that the province needs to help support the families by having more support in place for people who use drugs. Counseling, rehabilitation programs, safe drug supplies, and safe drug and injection sites. These sites work with the substance user where they are at. The person learns to trust and support staff, and when they're ready for help, they have the support system in place for that individual. Without intervention and support and reducing the stigma, many users choose to use alone. This puts a person at the highest risk of death. And with these numbers that we're seeing, this happen way too much. Please never use alone, or have a plan in place if you do. There are options such as the Brave app on your phone, NORS, doors, or options. Best yet, have a friend and a naloxone kit available. Always carry naloxone. Stigma. Stigma is a marked disgrace associated with a particular circumstance, quality, or person. It's a negative feeling that people have about particular circumstances or characteristics that somebody may have. Stigma can be anything such as alcohol, smoking, gambling, shopping, etc. When related to people with substance use disorder, it comes from possibly inaccurate beliefs that addiction is a moral failing, but it is a chronic, treatable disease, or it can be. Stigma can reduce the willingness of a person to seek treatment. Stigma can cause other people to be afraid of, or fearful, or angry, or distant to the person with substance use disorder. Language can negatively influence healthcare workers, and this may impact the care that a person who uses substance receives. So words matter. Instead of saying that a person is a druggie, a meth head, crackhead, or junkie, it is way kinder to say and use first language, such as a person with substance use disorder, a person with opioid use disorder, a reformed or a former addict. Say a person in recovery, long-term recovery, or a person who previously used drugs or substance. A drug habit should be considered a substance use disorder. Clean, does that mean they're dirty? Use not currently using or drinking. I was really upset with my son at one time. and they called him a junkie. It was a low point. It was a low point for both him and me. It crushed him and brought what little self-esteem he still had left to zero. It didn't make me feel any better and really hurt him. Please think about words that you're saying. They're difficult to take back and will not help, but will hinder an individual's journey. It's important to remember, however, that we're all going through this journey and learning how to better approach how we think about and respond to mental health and substance use disorders. We will experience missteps along the way, but offering forgiveness and grace to ourselves and others will go a long way to change the narrative. Awareness and education is the first step, followed by action, which we can practice with our intentional choice of words and advocacy. What you say and act upon does matter. Thank you. And I would like to introduce Rachel and Tiffany to come up and sing, please.